Good afternoon, my name is Fabiola Nanai, and today I'm going to speak for one of the communication styles that people use to express themselves and their feelings. The presentation will discuss the role of nonverbal communication in health and social care. The style includes sign language, body gesture, and facial expressions. Communication styles can be defined as the way that people use to express themselves, their emotions, and their feelings. The presentation will discuss the nonverbal communication style that guides the improvement in healthcare offerings. Nonverbal communication can be defined as the act of conveying information, data, or any other information without written words or verbal statements. This type of communication is defined as a bodily communication that happens through sign language, body gesture, facial expressions. The presentation will also explore the strength and limitation of this communication. There are several types of nonverbal communication used in every interaction. These include body language, eye contact, facial expression, touch, and tone of the voice. Facial expression contribute to effective nonverbal communication as they instantly convey emotion and reactions. In healthcare, warm and calm facial expressions help reduce patient anxiety and build trust with healthcare providers. In terms of reducing anxiety, healthcare providers build a strong connection through communication that help patients trust the providers. Purposeful movement of the hands and body, such as the waving of the hand or pointing with their hands, has intense meaning. In the context of reducing anxiety, gesture acts as a critical indicator that often relieves distress, and they may not articulate verbally. Additionally, eye contact is one of the most important social cues. Attentive eye contact is a sign of empathy and presence, helping the patient to feel heard, valued, and safe in critical scenario. This helps patients feel heard and valued during critical situation. The strength of nonverbal communication. Nonverbal communication happening in the healthcare sector is one of the crucial ways that accounts for 7 to 80% of communication. In the healthcare sector, a genuine smile or appropriate eye contact is a positive social cue. Nonverbal communication helps in increasing the accuracy by giving a more reliable and vivid understanding of the patient's true state by supplementing the information provided by verbal communication. The major strength of nonverbal communication lies in the fact that it acts as a universal language that facilitates healthcare professionals on a personal level. Further, it also helps a patient to feel more secure and relaxed during the time of the crisis. Nonverbal communication is one of the most important processes in the healthcare sector that leads to the building of trust and empathy among all the stakeholders, but it also has come of the limitation and challenges that can cause the misinterpretation of the symptoms or cause severe distress in the patient. Nonverbal actions or gesture can have various meaning in various cultures that can lead to a major misunderstanding. However, nonverbal communication also has severe limitation. For instance, eye contact may be considered respectful in some culture, but viewed as inappropriate in others. Person-centered care can be defined as the integration of the healthcare service in a setting to meet the requirements of the individual, keeping in mind the goals, preferences, and values of the patient. Application of nonverbal communication in person-centered care is very crucial as it helps in understanding the patient beyond the medical aspect. It is important to support effective care planning as healthcare professionals can tailor treatment approaches. For instance, observing the signs of anxiety or hesitation through nonverbal cues can help providers adjust the communication process. Additionally, including the act of listening actively and making sure that the verbal message and the gesture with each other, making it easier for the patient to build a relationship with medical representative with trust and empathy. A strong research verified example comes from the UK Dementia Services using a strong research verified examples comes from the UK Dementia Services using adaptation interaction, a method developed to support people with advanced dementia who have lost their speak. According to them, the caregivers trained in adaptive interaction have used a simplified approach to connect with the patient suffering on a personal level. 6 caregivers were assigned to one individual who was suffering from the disease. After the training with adaptive interaction, the caregivers slowly identified more ways of communication, so they can communicate more easier with the patient. This helped the individual into positive social behavior and meaningful engagement with the patient. The study showed that it's possible to train the staff to use more simple communication that is simply based on the format of nonverbal communication. Nonverbal communication plays a very crucial role in the healthcare sector and is closely interlinked with collaboration. This leads to the improvement of the overall outcome of the team and takes the dynamics to a better level. It enhances the quality of the diagnosis by increasing the trust as well as satisfaction of the patient. MDT or multidisciplinary team is formed with all the section of the people, starting from doctor, nurses to social workers. This team works on the quick response and often use nonverbal communication to have an effective outcome. The effective nonverbal communication help in coordinating the team, managing the emergency scenario, reducing errors, and building a professional report of the aspect for the patient. Nonverbal communication in the healthcare sector plays a very, very strong role as almost 50% of communication happens through it only. Improving these skills is essentially important to build the trust of the patient and to increase the satisfaction of the patient. The core development goals that are included are the development of self-awareness that controls one's cues, improving active listening, and having a more cultural inclusive space. The strategy for the improvement of nonverbal communication in the healthcare sector may include the incorporation of the SWETI model. These strategies can help in increasing effective communication. In the healthcare sector, to establish nonverbal communication, An individual must have the quality to understand the difficulties of the patient with empathy, unfolding long eye contact, have a good listening, with calm and composed tone, even during an emergency. There are certain limitations that an individual must overcome for effective nonverbal communication, to hold on to a posture that confidence during any emergency scenario. Additionally, an individual must be ready to take feedback and be self-aware to mitigate the misinterpretation problem, so to solve an emergency problem. It can be so in the conclusion, to draw a conclusion from the above discussion is that it can be stated that presentation mainly delved into understanding the style of the communication and also the type of it, giving a central stage to nonverbal communication. Additionally, it also helped in understanding the effectiveness of the communication type in the healthcare sector and how it can be improved in the long run. Thank you very much. This was my presentation. I hope you will understand a little bit about from the nonverbal communication and how its impact on our lives. Thank you very much.